Welcome to Dr. Mary Ann Block, Medical Detective. Dr. Block is the medical director of the Block Center, an international clinic for the treatment of chronic health problems in children and adults. She is the mom who went to medical school at age 39 to save her daughter. She is a top-selling author of 8 books. She is a physician who has helped thousands for over 20 years. She is a tireless advocate who speaks about the dangers of psychiatric drugs. And now, welcome Dr. Mary Ann Block, Medical Detective.
Hi, I'm Dr. Mary Ann Block, and today we're going to talk about ADHD, Attention Deficit Hyperactivity Disorder, and why I think it's simply symptoms and not a disease. So first, let's watch a video of a boy who manifests the symptoms that we call ADHD.
This is a video of a 9-year-old boy undergoing allergy testing for chocolate. Before allergy testing, he feels good, he's in a good mood, and he is cooperative.
So you're feeling pretty good this morning?
Yes.
Any aches or pains?
No.
No headaches?
No.
No stomach aches?
No.
Nothing? Great. In a good mood?
Yes.
The shot doesn't hurt. He uses the noise to distract himself.
It's my turn. Here we go. Okay. Great job.
All right.
Why?
You sit in the chair?
I want to do that toy.
Well, we need you to.
Oh.
We ask the children to sit still and concentrate for 10 minutes. The reaction to this first allergy shot makes him feel bad. It causes him to be uncooperative, belligerent, unable to sit still or concentrate.
How are you feeling right now, Wes?
Bad.
She said you can do some reading.
Reading? Tell you.
He is unable to do even the simplest of tasks.
Concentration!
Okay, you saw lack of focus, lack of being able to sit still and concentrate, behavioral issues. All those symptoms are what we call ADHD. The Diagnostic and Statistical Manual is the book that lays out every psychiatric disorder and the symptoms that go with it. And ADHD is a psychiatric disorder listed there. But here's the problem. Every one of those symptoms starts with the word often. Often can't sit still. Often fidgets in their seat. Often blurts out answers before being called on. Well, what does often mean? Well, it's totally different in every single person. So you have a teacher who thinks, well, children are children. They're going to move around. They're going to speak out. Well, that teacher probably doesn't think very many kids in the class have ADHD. But you take another teacher who really thinks children should sit still with their feet on the floor, their hands in their lap, raise their hand to ask a question. That teacher might think that half the classroom has ADHD symptoms because often is a subjective term. So ADHD is a subjective diagnosis. And when kids get this diagnosis, they're often given prescription drugs that are pretty serious drugs. So it bothers me that we have a subjective diagnosis that we're giving drugs to children that have some pretty significant side effect potential. Well, one of them is Ritalin. Ritalin's been used for over 50 years. So there's a thought that it's been around a long time. It must be safe, right? Well, what we don't hear about is that Ritalin actually goes to the same receptor site in the brain as cocaine. And Ritalin and cocaine are used interchangeably in medical research. Well, if they're that much alike, they can be used interchangeably. It really concerns me that we're actually giving cocaine to children to help them focus and concentrate. And nobody really wants to do that, right? There are other drugs like Adderall. Adderall is an amphetamine, just straight amphetamine. That's what it is. So where on earth did we come up with the idea of putting 6-year-olds on amphetamines to sit still and focus and concentrate in class? I mean, it sounds like it's kind of an overkill, don't you think? These drugs come with potential side effects. Ritalin side effects include depression, suicide, cancer, heart attacks, cardiac arrhythmias, and of course, abuse. And Adderall has that abuse factor as well because these are addictive drugs. Adderall side effects can be psychosis, behavioral problems, thought disorders, heart palpitations, high blood pressure, and even more serious problems with the heart. Now, we have drugs that are not the amphetamine type drugs, and one of those is called Strattera. And it's become very popular because many parents don't want to put their kids on amphetamines. Doesn't make sense to them. Strattera is an SNRI, a selective norepinephrine reuptake inhibitor. It's very similar to the drugs that we call SSRIs, or selective serotonin reuptake inhibitors, like Prozac, Paxil, Luvox, the antidepressants. Now, those antidepressants are contraindicated in children and young adults because of the increased risk of suicide. But we have a drug that is very similar in how it works, being used for children to help them sit still, focus, and concentrate. And SNRIs in other countries do have a suicide warning label on it. So it's very concerning to me that we're using these heavy-duty drugs on little children to try to get them to sit still, focus, and concentrate, when not sitting still and not concentrating is what little children do. That's normal. And unfortunately, I've known parents who had children that actually died taking these drugs. And I think that's an unfair trade-off to lose a child and simply because they couldn't sit still and focus and concentrate. I think we have to rethink this whole issue of drugging our children with these drugs that have such serious potential consequences. Now, there are nearly 50 million children, or adults too, taking these prescription drugs for ADHD. 50 million prescriptions for ADHD drugs. And that was in 2011. And that was a 40% increase over 2007. So 10% a year increase. We're even higher than that now, probably. And we're seeing more problems from the side effects of these drugs. ADHD drug emergencies have increased 400% in just 6 years. So these side effects are real. The kids are showing up in the emergency room from having the side effects. And it's a very serious issue that needs to be addressed. Now, the Journal of Family Practice published an article that stated that kids that were diagnosed with ADHD actually performed less successfully in school and in their occupations. They graduated from school in fewer numbers, and they didn't do as well in business when they got out. So if most of the kids that are diagnosed with ADHD are prescribed ADHD medications, and the result is they're not doing as well in school or in life, then something's wrong with this picture. And I think it's because we're drugging symptoms and we're not finding the real underlying cause of these ADHD symptoms. And there are many. Let's show more of the video of this young man.
After 10 minutes, he's given another dose of the same allergen, but this time it is the dose that makes his symptoms go away. After receiving the correct dose, he can sit still He can focus and concentrate, and he is no longer angry or belligerent.
Tell me how you feel.
Good.
Too busy working, huh?
Well, as you can see, his symptoms were caused from his allergies. He was perfectly normal. He was fine. He felt good. And then we gave him a little allergy injection, and everything went crazy. He couldn't focus. He couldn't concentrate. He got angry. He got belligerent. And when we found the right dose of that allergen and we neutralized his symptoms, he calmed down. He felt good again, and he could focus and concentrate, and he was no longer belligerent. It was that simple. So if that allergen food is taken from his diet, he's not going to have those reactions. So that's a really important piece of this ADHD puzzle. In fact, studies found that kids with allergies perform less successfully in school across the board in all ways. And so if allergies are that big of an issue, shouldn't we be diagnosing those allergies before we're putting children on these medications? Another underlying cause is their diets. Kids today, they're eating so much sugar. They're having a sugary cereal for breakfast, and a couple of hours later, they're sitting in the classroom. They're supposed to sit still. They're supposed to be able to focus and concentrate, but they're in a state of reactive low blood sugar from eating all that sugar at breakfast. And when that happens, the body releases adrenaline, which is that fight or flight chemical. And when adrenaline's on board, you can't sit still, you can't focus and concentrate, and sometimes you don't act very nice. So when that adrenaline is on board from eating that sugar, we see symptoms that get called ADHD. But let's call it what it is: low blood sugar from a poor diet. So let's change these kids' diets. Then there's nutritional deficiencies. You know, there was a study that found that vitamin B6 actually worked better than Ritalin in a group of hyperactive children. There are dozens of studies in the medical literature about nutritional deficiencies affecting the symptoms that we call ADHD. And then let's talk about learning problems. You know, we all expect children to start kindergarten and be able to learn. But the thing is, we all learn differently. Some of us learn best listening. Some of us learn best by looking. Others learn best by touching. And if you are a tactile learner, if you learn best by touching, and you're sitting in a classroom where the teacher is just speaking to you, your tendency is to touch things, to fiddle with things, to move around in your chair. And then you get in trouble for that, but you're simply trying to learn the best way you know how, through touch. The solution to that, of course, is to teach children the way they learn, or teach them how to learn the way we're going to teach them. If we could do that in kindergarten, I think we'd find very little need for the diagnosis of ADHD and very little need for these medications. So it's important to always try to find a doctor who's going to work with you to try to find the cause, fix the problem, and not just cover symptoms with drugs. Thank you for joining us. Hope to see you next time.
Thanks for watching this episode of Dr. Mary Ann Block, Medical Detective.